Welcome back. My name is Wileen and I'm Director of Foundations of Health Medical Academy. Today we're going to be learning the skill of changing an occupied bed. Changing an occupied bed means that there is someone in the bed and they will not be getting up while you change the sheets. Maybe they're paralyzed, maybe they're weak, but you're going to change the bed with them still in it, and it is possible. So I'm going to gather my supplies and we're going to get started. May I come in? Hi, Mrs. Smith. My name is Wileen. I'm your CNA for today, and I've come to change your bed. Is that okay? Yes. May I check your band? Okay, Mrs. Smith. I'm going to close your curtain for privacy, wash my hands, get my supplies, and I'll be back. I'm washing my hands and getting my supplies. And I'm going to announce that I'm back. I'm back. Everything must come in the room in a container. You never want to put linen on your clothing for infection control. So I'm going to carry everything in a bag and out of bag. I'm going to place the bag on the bed while I get set up. I'm going to use this pad as my barrier. You can also use a towel, or you can use a wipe to clean the table off to put your clean linen. For this skill, you will need 2 flat sheets, a fitted sheet, a pillowcase, and a pad. You will also need a bath blanket for privacy. I'm going to take everything out of the bag so I have somewhere to put my soiled linen. I'm going to cover Mrs. Smith with this blanket so that I can take the dirty blankets off. I'm going to put this privacy blanket on you, okay, Mrs. Smith? You want to always talk to your patient for indirect care. I'm going to take your sheet off, okay? Are you okay, Mrs. Smith? I'm going to take the top sheet completely off. And I'm going to put it in this bag that I already had ready. Now I'm going to prepare Mrs. Smith for the bed to be made. Mrs. Smith, can you put your arm here, please? Lift your knee, please. Okay, Mrs. Smith, always keep her covered. Turn, please. And of course, Mrs. Smith wouldn't fall all the way over like that, but you want to make sure her body is still covered. And I'm going to work on this side of the bed first. I'm going to start with the fitted sheet. And I'm going to fold everything in because this bottom part is clean. And I'm going to roll. I'm going to tuck this under Mrs. Smith's buttocks. I'm going to put this under Mrs. Smith's leg. And I'm going to take this all the way over, and this side of the bed is ready to be made. So I'm going to start with the fitted sheet. Are you okay, Mrs. Smith? Okay. And we're going to work from one side, and then we'll do the other. this is the top of the sheet. And you're going to take this sheet and put it under the dirty sheet because that part is still clean. And tuck it under there. Nice and smooth, no wrinkles. Because wrinkles promote bed sores. Tuck this in nice and neat. And this is my draw sheet to help pull her up in the bed if I need to. And this folded side goes up towards the patient. I'm gonna lay it across the bed just like that. I'm gonna lay the pad across the bed just like that. And then I'm gonna roll this halfway towards me so that I can tuck it under Mrs. Smith. Okay, Mrs. Smith, I'm gonna lift that dirty sheet up and put this under there. This side of the bed is complete. Okay, Mrs. Smith, can you lay back, please? I'm gonna grab her from the hip and the shoulder and she'll roll back. Are you okay, Mrs. Smith? Always remember to keep her covered up. Her that way. Okay, Mrs. Smith, I'm going to turn you to your other side. Can you put your arm here? Make sure you put her in proper positioning. Lift your knee, please. Always put your hand under the knee and help her put it up or help. Keep her covered. Okay, Mrs. Smith, turn please. I'm gonna make sure Mrs. Smith's body is still covered and she's comfortable. Now I'm going to roll the dirty sheet from under her. And I'm gonna ball it up. It all comes together and put it in the bag that is already ready on the bed. And this keeps the clean stuff away from the dirty stuff. Now I'm going to pull everything to me. The fitted sheet, and this is already, let me show you. And this is the one we rolled under her. We're just gonna roll that out. And we wanna make sure we show them that it's nice and smooth and get rid of any wrinkles. Because where there's wrinkles, there's sores. And you won't be able to get rid of every wrinkle, but for the most part, the bed is wrinkle free. Okay, now I'm gonna help Mrs. Smith lay back down. Okay, Mrs. Smith, can you lay back, please? I'm gonna pull her shoulder and her hips, and she's gonna fall back naturally. Put her legs back in place. Are you okay, Mrs. Smith? Okay. And now I'm gonna cover her with her top sheet. And I always suggest that you find the top part of the sheet. This thickest border is the top of the sheet. So that will go closest to the patient. And then you want to miter your corners. And the way to do that is to pull this sheet out over the edge of the bed. You're going to tuck this under the mattress, nice and neat. And then you're going to pick the sheet up anywhere around here. So I'm going to pick this up and throw it on the bed. And the rest of this from the end of the bed towards me, I'm gonna pull it towards me, nice and tight. Tuck that in. And that makes a nice and neat mitered corner. And I'm gonna do the same thing to the other side. And then I'm going to remove this blanket, the bath blanket. I'm going to remove it from under the sheet. So the patient is never exposed. I'm going to pull that out and ball it up and put it in the bag. And now I'm going to change her pillowcase. Mrs. Smith, I'm going to support her neck or help her support her neck. And I'm going to say, Mrs. Smith, lift your head, please. I'm going to take this soiled linen away from the bed because I have clean sheets. And I'm going to put this directly into my bag. I will then roll my pillowcase down like a sock and use the pillow as a toe. And I'm going to put this onto the pillow like so. Once I put that top part on, I'm gonna hold my pillow up and pull this pillowcase down like a dress. Make sure not to touch your uniform with the pillowcase because you are out and about with multiple patients. So you don't want to contaminate things from one person to the next. And this closed side goes towards the door. So if the door is right there, I need to face this closed side towards the door. The open side is away. Mrs. Smith, lift your head, please. Okay. Mrs. Smith's bed is all done. So now I'm going to do my exit. Mrs. Smith, do you need anything? No? Okay. Well, here's your call light. If you need anything, call me. I'm going to put your bed down for safety. I'm going to open your privacy curtain. I'm going to take my supplies. I'm going to wash my hands, document, and my skill is complete. That's changing an occupied bed. Next skill.